Welcome to this introduction to report analysis. I'm Jackie Bell, and I'm an education and training specialist here at Alpha Thermodiagnostics. This is an introductory module intended to outline the basic components of the AlphaView report. We'll go over each section of the report, including the elements of the last page, which has a graph of the temperature readings and tables that summarize the data. It's important that you understand this basic information so that as you continue with more of Alpha's report trainings, it'll be easier for you to follow along. There are several pages to the AlphaView report, and through your trainings you'll discover that every section carries insightful information, very often key information that'll help you decide on the best treatment strategy for your patient. So that when a patient comes in with presenting symptoms or a diagnosis, you'll know how and when to address the priorities and direct further diagnostic testing. For example, here's a 51-year-old female patient who has a breast lump. Even though the priorities are showing that there's physiological dysfunction in the breast and underlying issues of possible heavy metal toxicity and a systemic virus, among other things, there's even more information in the report for you to consider when you're determining what to do. So we're going to teach you what to look for in the graph of the temperature readings. And we'll teach you where to look in each section of the report for confirming information, such as Section 1, which lists the bioregulation results, and the breast analysis section, including the signatures and gradings for breast dysfunction, and of course the dental relationships section to determine if there's a focus, such as an infected cavitation, that could be causing a disturbance to the physiology. So it's understanding this whole body integrated perspective of the physiology that will give you the edge in determining the best course of action and treatment strategy for your patient. Even though all the information from the last page of tables and graph data has been translated for you into images and descriptions throughout the whole report, we're going to start by learning the components of the graph, and from there we'll go over each section of the AlphaView report. Let's talk for a minute about what happens during the regulation thermometry test. The test is conducted in a controlled room temperature setting, and the patient comes in wearing long sleeves and long pants. A first set of temperature readings is taken at skin points all over the body, and then disrobed, the patient continues standing for 10 minutes. After the 10 minutes, a second set of temperature readings is taken. The cooling period acts as a subtle thermal stress, and for a healthy patient, this should cause the body to shunt the blood to the core and to the head and result in the skin temperature in the body from the neck down to cool and on the head to warm. The before and after temperature readings for each point are plotted on a graph. The first reading for each point is plotted in a gray color, and the second temperature reading is plotted next to it in a color coded according to its behavior relative to the first reading. There should be a change of temperature between the first and second readings at each point. How much the temperature changes and whether it's warmer or cooler defines what we call the point behavior and reflects a transmission of signals related to the regulation capacity of the underlying organ or tissue. Now let's review the types of point behavior by going over how to recognize them on the graph. Here's an illustrated close-up of just the temperatures. First, the patient's baseline temperature, calculated from the first set of readings, is added, placed as a horizontal line. Then the first set of readings are graphed, not in a horizontal line, but as a vertical one and relative to the baseline. The second set of readings are graphed alongside the first readings at each point, again as a vertical line relative to the baseline temperature. When we determine the behavior of a point, we look at the temperature difference between the first and second readings. Now for the body points, normal regulation means that the second temperature is 0.3 to 1 degree cooler than the first temperature reading. Normal regulation is the expected healthy response for that measurement point. There are 4 other point behaviors. The first one is when the second reading is the same temperature as the first. This is called blocked or rigid regulation and means that the underlying organ wasn't able to respond at all, or there was an overriding interference. So blocked regulation is most often seen when there's a lack of regulation capability due to organ dysfunction, a focal infection, heavy metals, or even scar tissue interference. The next behavior is hyporegulation. This is when the second reading hardly changes and is nearly blocked, changing less than the normal amount, meaning less than 3/10 of a degree. Although hyporegulation is not as severe as blocked regulation, it should be noted. Paradox regulation means that the response is opposite to the normal response. So for the body points, it means that the second temperature warmed compared to the first temperature, which is a reflection of an inflammatory response, meaning an underlying process of inflammation. Hyperregulation is a response that's an exaggeration of the normal response. So hyperregulation for the body points is an excessive cooling, which is a hypersensitive allergic response seen with chemical toxicity or toxic buildup in general, and it can reflect an autoimmune condition if it's systemic. These 5 behaviors apply to the body points from the neck down and the maxillary sinuses, which are the one exception of a head point that behaves like a body point. Now for the head points. Normal regulation for head points means that the second temperature reading warmed almost half a degree. This is the normal, healthy response. Blocked regulation again means that there was no temperature change due to functional incapacity or an interference such as an infection. Hyporegulation is nearly blocked with a subnormal temperature change. And paradox regulation means that the temperature cooled instead of warmed, reflecting a lack of blood circulation often seen with toxicity. And finally, hyperregulation means that an exaggerated warming occurred, and this higher than normal increase in circulation reflects an inflammatory response. These are the regulation behaviors for the points on the head and the thyroid. The thyroid is the one exception of a body point that behaves like a head point. When all the readings are graphed, we can see the behavior of individual points as well as patterns of behavior in regions of the body and throughout the thermogram as a whole. For now, let's take a close-up of the graph and familiarize you with its components. Along the sides of the graph are the temperatures in Celsius degrees, and along the top here are the labels for the measurement points. Each region is labeled at the bottom and given a number. So here you can see the head region is number 1. The patient's baseline temperature is the red horizontal line, and the shaded yellow background is the ideal temperature range for each point. The first readings for each point is gray, and graphed as a vertical line relative to the baseline as we said before. And the second reading for each point is graphed next to the first reading and colored according to its behavior. Now here's the graph for the ideal thermogram. Notice that all the temperatures fall within the yellow shading that ranges above and below the baseline temperature, and that all of the second temperature readings at each point are colored blue for normal regulation. A close-up of the head area shows that the normal temperatures for the head should be above the baseline, and that the second temperature readings should be warmer than the first. This is true of the glabella and radix nasi, but the maxillary sinuses, as I mentioned before, cool instead of warm. This is the ideal for the dental areas. This is the upper jaw, right and left. Notice that there are areas 7 and 8. Again, measurement point labels are at the top. The dental points are the universal teeth numbers used in the United States. The ideal range in yellow is a curved sine wave, with the front teeth ideally warmer than the molars. Here's the ideal lower jaw, so you can see the teeth numbers at the top, and again the ideal sine wave in yellow. Notice that the normal dental regulation is a slight increase in temperature. Here we have the ideal breast readings, actually for the left breast. The point labels are at the top as usual, and you can easily match them to the breast point diagram and see exactly where there's dysregulation. There's the patient's baseline temperature, a first reading, and a normal second reading beside it, and the ideal range in yellow. Notice how the breast points are the coldest points on the thermogram and should all be below the baseline. Okay, let's move on to the data tables. There are two data tables above the graph. There's the body table that relates to the body points, which is the upper half of the graph, and there's the dental breast table that relates to the dental and breast areas. Let's look closely at the body table and how it summarizes the temperature data and point behaviors by area of the body. Areas 1 through 6 are listed on the left, and each number has a corresponding area of the body on the graph. This row is the average of areas 1 through 6, and I'll go over what the numbers mean in a moment. The CF is an average of the cubital fossa points on the arms. The cubital fossa points are measured twice, and that's why there are two sets, CF1 and CF2, and CF3 and CF4. Now let's look at the dental and breast table. The dental areas 7, 8, 9, and 10 on the left correspond to the 4 dental quadrants, and the breast areas 11 and 12 correspond to the right and left breast. There's a legend with colors that correspond to point behaviors. All the second readings are colored accordingly. The blue colors are for normal and hyperregulation, and here you can see the blue breast points that are normal and hyperregulating. The dark purple, almost black color is blocked regulation, which you can see in the upper jaw. Pink is hyporegulation, and yellow is paradox regulation. Now the types of regulation behavior are also summarized by region. Here you can see a high percentage of rigid, meaning blocked, and paradox regulation in the dental areas 7 through 10. The percentage reflects the number of points that fall within the different categories for each region. And in fact, area 9, the right lower jaw, has the highest percentage of rigid regulation and may be of concern here. The disorder index signifies conformity to the ideal temperatures and behaviors. The more conformed and organized the temperature and point behaviors in a patient's thermogram, the better. The disorder index is on a scale of 1 to 10. The lower the value, the better. It means there's less disorganization and disarray, and more order and regulation capacity, which the ideal thermogram epitomizes. A high disorder value means high disorganization and low regulation capacity. DIA signifies the disorder index for the first set of temperature readings in each region, and DIB signifies the disorder index for the second set of readings in each region. If DIB is lower than DIA, then it shows compensation, and that reflects the area's ability to regulate appropriately in response to the stress stimulus. If DIB is higher than DIA, then the disorder has increased, which reflects decompensation and a weaker regulation capacity. Ideally, you want to see low disorder and you want it to decrease. And finally, there's a calculation of the average temperature for each region for each set of readings. TXA is the temperature average for the first set of readings in each region, and TXB is the temperature average for the second set of readings in each region. And the TRB is the average of the second temperature readings on the right side of the body for each region, and TLB is the average of the second readings on the left side for each region. Now for the dental and breast regions, which are a little different. TXA is the temperature average for the first set of readings, and TXB is the average for the second readings, but TRB and TLB are not necessary. The reason is that areas 7, 9, and 11 are on the right side of the body, and areas 8, 10, and 12 are on the left. So TXA and TXB are actually the average temperatures for the right and left sides of the dental and breast areas. Since temperature symmetry is the expected norm, We can check TXB for the upper jaw, area 7 and 8, for right to left side asymmetry, to see if one side is warmer than the other, as we can with the lower jaw, areas 9 and 10, and the right and left breasts, areas 11 and 12. Now that we've gone over the elements of the graph and tables, let's go back to the first page of the report and start reviewing each section. The first section is called Thermographic Bioregulation Results, and this is the most important part of the report because you'll find a description of all the findings by region, meaning area of the body. On the left is a list of the regions from the head, neck, and chest all the way to the breast region for women. And at the top you'll find the general identifier patterns, which are derived from whole body systemic signature patterns. And this is the section where you'll find information about the disorder for each region and whether it increased or decreased. You'll also find a description of recognized physiological signature patterns and their corresponding level of progression or grading, which will be either minimal, moderate, or severe. Section 2 is priority for treatment, and it has a list of priorities for you to consider in light of all the findings and the patient's case and history. Each priority has a corresponding recommendation, suggesting further testing and general medicines. The first sentence in the recommendations is a conventional medicine suggestion, and the rest are naturopathic and integrative. Section 3 is the generalized overview of suspicious regions and has 2D images that illustrate the point behaviors, which are the temperature responses that I described earlier. This is the best section to review with the patient. It allows you to point out the areas of concern and talk about your treatment strategy. Let's look closer at the illustrations of the point behaviors and review what they mean. The color legend for the body and neck points is different than the legend for the head points. Here we can see that normal regulation is in light blue and illustrates a normal, healthy regulation response. Hyperregulation is darker blue and shows where there is a hypersensitivity due to toxicity, showing an exaggerated allergic response. Systemically, it can reflect an autoimmune process. Blocked regulation is the darkest color, almost black. This is where there was no temperature response, reflecting either functional incapacity or an interfering disturbance, typically from a focal infection or systemic heavy metal toxicity. Blocked regulation is where there's usually the most concern. Hyporegulation is similar to blocked regulation but not as severe, and it's where there's a minimal and deficient regulation response. Paradox regulation is colored gold, and for the body points it means an opposite and warming response, seen with increased vascular circulation due to an underlying inflammatory process. Haughton paradox is when the first reading is significantly warmer than normal, and the second reading increases in temperature instead of the normal cooling regulation, reflecting a severe inflammatory response. Now for the head area, where the legend has a different coloring system for point behavior. Normal regulation for a head point means that the second reading increased in temperature just less than half a degree. No coloring is added to the illustration for healthy, normal regulation. Hyperregulation is colored red and means there was an exaggerated warming, reflecting an above normal increase in circulation and an inflammatory response. Blocked regulation is the darkest color, showing no temperature change and a lack of regulation capability, reflecting dysfunction and a possible focus. Blocked regulation in the teeth, however, reflects dental toxicity. Hyporegulation in the head is the pink coloring, showing nearly blocked and deficient regulation. And paradox regulation is colored blue, and it reflects an opposite and cooling response and lack of circulation often seen with a buildup of toxins. Yellow coloring in the teeth refers to dental infection that you'll see more clearly in the dental section of the report. Section 4 has 3 subsections that portray the dental health and systemic connections. the dental diagram and legend, the quadrant stress chart, and the tooth organ connection chart. Let's start with the dental diagram. On the dental diagram, the universal numbering system used in the United States is located between the upper and lower jaws, and the international numbers are above the upper jaw and below the lower jaw. The legend shows colorings for possible infections, focal disturbances, and dental toxicity. Teeth are colored multispeckled in gray when two contiguous teeth differ in temperature and one is drastically warmer than the other. It's the warmer speckled tooth that has the highest suspicion for a focal infection or an abscess in the tooth or jaw. Keep in mind that when you're considering whether a tooth has a problem, say tooth 28 in this case, it's important to look at the mini region, which includes the tooth on either side of it. So in this case, you would investigate teeth 27 and 29 as well. The gray polka-dotted coloring means there's a region that's lost the ideal sine wave curve, and this reflects possible underlying infection or inflammation and gum disease. Although this is not as high of a concern as the speckled tooth, it's good to investigate the dentistry in that area and possible jaw involvement too. The black coloring reflects blocked and toxic teeth. The toxicity can come from past or present dental materials or local bacteria. And finally, the red arrow will point to the warmer quadrant if there's temperature asymmetry between the right and left sides. The warmer side is always the one for concern and is usually related to TMJ or structural issues. Any teeth that are multispeckled, gray, or polka-dotted will be listed in the focal connection tooth-to-organ chart. The tooth and organ correspondences and meridian connections can give you insights into the relationship between the teeth and organs or other areas of concern. The quadrant stress chart will highlight the most stressed quadrants in bold lettering and can reaffirm dental areas of priority. So pulling together information from the dental analysis, such as suspicions of infection and corresponding organ and meridian connections, can corroborate the results and determine the possibility of the causation coming from the teeth. The breast analysis section has 4 parts: the 2D illustration of the point behaviors, a chart of the breast suspicion criteria, a bar diagram of signatures for breast dysfunction, and a summary outline. Since we've already reviewed the colorings of the 2D image, let's move on to the breast suspicion criteria. The breast suspicion criteria are the most important aspects of the breast analysis because they've been determined to contribute to and influence the breast health. Having 5 or fewer criteria marked as out of range is normal. Any more and we can start to be suspicious about the presence of the progression of breast dysfunction. The criteria include the functional response of the sternum point, the chest area, and the breasts. The sternum point acts as an alert point, so if it's blocked, then it's important to pay closer attention to everything in the chest area, including the breasts. The disorder or lack of an organized regulation response in the chest area and breast is also important. The liver, ovaries, and stomach are organs that can affect the breast health. The liver and ovaries are involved in estrogen production, and the stomach meridian goes right through the breasts. The stomach meridian is also connected to certain teeth, which is why the second molars are included in the criteria. And then the lymphatic system's health and the terrain, which reflects the body's toxicity and regulation capacity, also affect the breast health. And finally, there's the temperature asymmetry between the right and left breasts. Unless the patient has had a mastectomy, the right and left breasts should have the same average temperature. The illustration of signatures and gradings for breast dysfunction is helpful because it gives you a visual of the degree of dysfunction in the breast as well as in the underlying influences. The signatures for breast dysfunction in particular are the mastopathy inflammatory and the fibrocystic cystic patterns, as well as the breast block spot and side difference, which is the temperature symmetry. The rest of the signatures are systemic and are collected from the whole report. These can play a causal role in breast dysfunction and disease progression, so it's especially important to address the signatures that have moderate and severe gradings. The prostate analysis is similar. The suspicion criteria have been found to contribute to prostate health, and having 4 or fewer criteria marked as out of range is considered normal. 5 or more raises suspicion for prostate dysfunction. The criteria for prostate include the regulation behavior of the prostate itself, the kidneys, and the pancreas. In traditional Chinese medicine, the kidneys control the prostate, and the pancreas points are on the kidney meridian. The front teeth are included because they're connected through the kidney meridian as well. And the functioning health of the lymphatic system, including the inguinal nodes, combined with the terrain, also influence the prostate. The signatures for prostate dysfunction include prostate blocked regulation and the suspicion for hypertrophic change. The whole body contributions are collected from the rest of the report and can influence prostate dysfunction and disease progression. And finally, it's important to resolve the signatures that have moderate and severe gradings. The last section of the report is the dysregulative pattern signatures, which gives you a visual summary of the physiological dysregulation by regions of the body. The first set of patterns is the whole body identifier patterns. These are systemic patterns derived from analysis of the whole thermogram. They include toxicity and heavy metal signatures, the physiological compensated pattern, which relates to the disorder index, and immune system and blood circulation signatures. Notice that the presence of each of these patterns of physiological dysfunction is graded either optimal, minimal, moderate, or severe. In the head region, you'll find disturbances ranging from brain toxicity and cranial dysfunction to a systemic viral signature and sinus dysfunction. In the dental area, you'll find confirming information from the dental section of the report. In the neck region, you'll find information about the lymphatic system and thyroid, as well as whether there's a head or torso emphasis, which lets you know if there's more dysfunction stemming from the head or the rest of the body. The chest region lists dysfunction ranging from the cardiac function and conduction to the lungs and bronchi and the axillary lymph. The upper and lower abdominal regions include dysfunctional signatures for the digestive organs, the stomach, liver, and pancreas. The lower abdomen includes signatures involving the small intestine, colon, and appendix, such as food intolerance and dysbiosis. The pelvic area shows signatures for toxicity and dysfunction in the uterus and ovaries for women, and prostate dysfunction for men. The kidney and back region shows kidney dysfunction and spinal problems. And the side alert refers to whether there's the signature for a focal disturbance on the right or left side of the body, which is determined by the regulation responses of the cubital fossa points on the arms. Thank you for joining me for the introduction to report analysis. Now you're ready for your next level of report training.